Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are in the middle of our Women's Health Month. And today we'll be talking about women and exercise, medicine for aging. Dr. Suezie Kim is here with me today. She is with Tucson Orthopaedic, and she specializes in sports medicine. So we're so thrilled to have you here today, Dr. Kim.
Thank you.
So you may be watching us today on either our YouTube channel or our Facebook channel. If you have any questions, please feel free to leave those in the comments, and we'll go ahead and let Dr. Kim get started.
Great. Thank you so much, Maya. So I am very happy to be here today to talk to you about sports medicine, particularly for the more mature female athlete. It's very nice to meet you. My day job is as an orthopedic surgeon here at Tucson Orthopaedic, but my life job is as a wife and a mom. I have 3 children, most recent one born about 4 months ago. So my life is pretty busy. So our talk today, like I said, is sports medicine for the mature female athlete. Why is this important is the first topic that we will address. The second thing I will talk about is the biology of aging, then the types of injuries associated with being a female athlete, the treatment of these things, of these injuries, and then prevention. So we'll get started here. Why is this topic so important? So there are many more mature athletes out there than in the past. People are living longer. The CDC life expectancy in 2020 shows that females live to about 80.5 years, males about 75.1. Currently, about 15% of the US population is over the age of 65, and that might continue to increase. Older athletes are also performing at much higher levels than before. There has been an increased participation in elite level endurance events for people over 40. And those older participants are participating for longer periods of time. They're able to compete and even outcompete historic comparison groups and even younger athletes. Also, this topic is important because age-related decline is not inevitable. So when you continue physical activity, it can help to mitigate comorbid conditions. It can slow the primary effects of aging. And the disuse deterioration can also be minimized. Secondary chronic medical problems can be avoided or delayed, and physical activity can increase average life expectancy. So now we'll talk a little bit about the biology of aging. What happens to your body as we start to age? So when you look at the grand scheme of things, every body system does have some deterioration associated with aging. Cardiovascularly, you have a decrease in your maximum heart rate, the contractility of your heart goes down, oxygen utilization goes down, and vascular compliance also gets affected. In the pulmonary system, you see some decreased elasticity of the lungs, decreased compliance, respiratory effort, as well as total capacity. Renal function also decreases in perfusion as well as filtration. But the topic we're going to concentrate on today is the musculoskeletal system and how aging affects that. So there's individual aspects of the musculoskeletal system that I'm going to tackle. But in case you're unfamiliar with what all these terms are or where exactly they are in the body, we'll just review a little bit about the anatomy. So here's just a basic picture. I use the knee as just an example. Most commonly, the muscle and bone, most people understand what that is. But the tendon is a structure that connects the muscle belly to the bone. So the tendon is the connection between those two structures. Ligaments, on the other hand, connect just bone to bone, as you can see in this picture. Cartilage is the lining of the bone at the joint level where motion occurs. So all of your joints in your body has cartilage lining it to allow for smooth, frictionless motion. The meniscus, which is specific to the knee, is a structure that lives on top of the leg bone and also on top of the cartilage that helps to act as a shock absorber to the knee. So we'll first talk about bone and the biology of aging. As we age, there's a progressive decline in bone density. Osteoporosis is a term that's used often, and it is because once you get over a certain age, the chance of osteoporosis increases. And this is defined as porous bone. 1 in 4 women over 65 have osteoporosis, and the bone loss begins as early as age 35. But many people don't even know they have osteoporosis until they break a bone. So we start with some lab work, and this may help to identify some secondary causes of osteoporosis. Secondary causes of osteoporosis can include rheumatoid arthritis, premature menopause, hyperthyroid, celiac disease, Paget's, chronic liver or kidney disease. We can also diagnose this by getting some imaging, and most people probably have heard of either a DEXA scan or a bone scan. This is similar to an X-ray, but it allows us to determine a score to define if you have osteoporosis or not. So there's 2 scores when it comes to a DEXA scan. There's a T-score, which is actually used for the diagnosis of osteoporosis. This score is comparing your bone mineral density to the ideal bone mineral density of a 30-year-old. So if this score is under a certain value, then you are determined to have osteoporosis. On the second hand, there's another score called the Z-score, and this can help to point to secondary osteoporosis. This number compares your bone mineral density to other people your age. So there's no hard number that identifies people with secondary osteoporosis, but it may help us to further look into a secondary cause with things like lab work. Next, we'll look at ligaments and tendons. As we age, it increases in stiffness, it decreases in compliance, it decreases in vascularity, and so therefore it increases your risk of failure at the ligament or the tendon level. The third item is your meniscus. Like I said, it's the shock absorbers of your knee. As we age, you start to see some intrasubstance degeneration, loss of shock absorption, as well as an increased risk of tearing. Next is the cartilage. Those are the structures that are at the ends of the bones where motion occurs. You start to see deterioration in that as well, and this can be due to a combination of genetic and environmental factors. Lastly, the muscles also can age, and there's decreased muscle fiber size, there's progressive muscle denervation, there's decreased flexibility, and there's degenerative structural changes. Now, what all of this leads to as we age is potentially an injury. So the 2 different types of injuries we're going to talk about in sports is an acute injury. This is from a single traumatic event, and they can include strains, sprains, and fractures. It's common with people who participate in sports that require high coordination, quick reaction time, as well as balance. So this can include ball games, tennis, basketball, pickleball, skiing, maybe gymnastics. The other type of injury we see are chronic injuries, and these are typically due to overuse, wear and tear over time, and it can also be associated with poor technique, training, or equipment issues. So we'll dive into each of these types of injuries. So the first one we'll talk about is the acute injuries. And most people have a little bit of confusion in terms of the nomenclature of all these terms. So I'll just kind of explain what strain, sprain, fractures mean. So a sprain is an injury involving the ligament. So if we can look back at the anatomy that I spoke about earlier, the ligaments connect bone to bone. So an ankle is a common location for this. The strain, on the other hand, is an injury of a tendon, which is where your muscle, it's how the muscle connects to the bone. So in this picture, the Achilles tendon is being shown. A fracture, on the other hand, is a broken bone. So this is a pretty obvious bone where the wrist is broken and the hand looks like it's completely off of where it needs to be on the arm bone. So in order to differentiate the smaller injuries, which are strains and sprains, from the bigger injury like a fracture, we look for some clinical signs. So the most obvious thing is going to be a deformity. This patient who has this wrist fracture is going to have a severe deformity of the wrist. It's going to look like a fork with it angulated very differently than how your wrist is supposed to look like. Other factors that you can, other symptoms that you can see are rapid swelling and rapid pain. And that's because when you break a bone, there's a decent amount of bleeding that occurs. Sprains, on the other hand, which is the muscle tendon junction, can have swelling and feelings of instability because it connects, sprains, which is the ligament. See, this is even confusing for me. The ligaments can have feelings of instability because it connects the two bones. Strains, strains are the junction at the muscle and the tendon, can have swelling, but they can usually also have a sensation of the muscle not moving correctly, since this is the connection for the muscle to the bone. And now we'll talk about some chronic injuries. So once again, chronic injuries are typically due to overuse. And the rotator cuff tendon is a good example of this. So once again, the tendon is a connection between the muscle and the bone. So the tendon is this white area in this illustration. And I'm just going to talk about some words that are used, especially when it comes to rotator cuffs and what they mean. So tendinosis, the bottom picture here, is a condition of the rotator cuff where there's some degeneration, likely due to age and decreased blood supply. When it's stressed or injured, recovery is not as quick or as complete as it used to be. On the other hand, tendinitis is something we use when the tendon is injured or inflamed. Anything that ends in itis is the word we use when something is inflamed. The third injury that can occur in the rotator cuff is a tear. It's where you can have a tear from like an acute trauma, like a fall. However, sometimes this can actually happen as a chronic overuse problem. So that's where the actual connection between the tendon and the bone has been disrupted. Another chronic injury that we see in sports is osteoarthritis. So a normal x-ray of a knee shows pretty equivalent space in the compartments of the knee. However, when you start to get degeneration of the cartilage, which once again is the lining of the bones where the motion occurs, the lining actually wears down pretty asymmetrically. So as you can see in this picture, this x-ray is showing that there is no space on the inner aspect of the knee at all really left. So the cartilage is nearly completely gone in this one. And that's what arthritis is. So now that we've talked about the injuries and what can happen, we can talk about some treatment options. So first and foremost, we usually try to treat most of these things without surgery. The first thing that most primary care doctors, ER doctors, or even orthopedic surgeons would recommend is RICE, rest, ice, compression, and elevation. Healing times can take about 6 to 12 weeks, but it really depends on how much weight bearing that particular joint or stressed ligament or tendon bears. So something on the foot, ankle, knee, or hip might take longer than a shoulder or a wrist. So when should you see an orthopedic surgeon? When you have an obvious deformity or suspicion that you have a fracture, it is important to see an orthopedic surgeon as soon as possible. So an obvious deformity, significant pain, or inability to bear weight are good indicators to see a surgeon ASAP. Otherwise, you can give the appropriate 6 to 12 weeks of time with rest, ice, compression, elevation. And if the pain and swelling improves, you can slowly return to activity cautiously. However, if you are unable to return to activity, you can see an orthopedic surgeon for further evaluation. If it's not a surgical problem, at least urgently, most of the time we try physical therapy to see if that might help. Healing is a biologic process, and there's not a lot we can do to speed that up. But gentle motion and some structured strengthening programs, especially through physical therapy, can help rehabilitate and return to sport a little bit sooner. And sometimes we can do home exercises for this, but when there's significant stiffness or loss of strength or endurance, physical therapy can be really, really helpful. And then we come to operative treatment. So I'm a surgeon. This is what I do for a living. I hate to see people need to get surgery, but surgery can be very effective in specific injuries. So urgent surgeries that require pretty quick attention are things like fractures. There's specific tendon ruptures that also need to be fixed sooner than later. These include the biceps tendon, if it's the distal biceps tendon near your elbow, your quad tendon, your patellar tendon, your hamstring tendon, Achilles tendon. So these are things that typically show up with a significant deformity or inability to ambulate or a significant pain and swelling. So those early signs are pretty evident. So then you can come see an orthopedic surgeon soon so that if you do need surgery, we can book you for it within a couple weeks. So the first type of operative treatment we do that I want to talk about is what's called open reduction internal fixation. It's just a fancy way of saying you have a broken bone, I open up the skin and take a look at bones, move it back in place, and then fix it internally with plates and screws. So this is a x-ray of somebody who had a broken wrist who underwent surgery. And as you can see, the wrist looks better. The hand is on top of the forearm now. And there's a plate and lots of screws holding everything in place. So when it comes to this type of fixation, the plates and screws are not actually making the bone heal any faster. As I mentioned earlier, biology takes its time. So bones typically take about 6 weeks, but the plate and screws allow the bones to be in a better position than where it had been in the past so that it heals with appropriate alignment. The next type of treatment I'll talk about is what's called an open repair. This is an example using a hamstring rupture. So sometimes people rupture their hamstring in their buttock region, so right at their sit bone. On this image to the right, the illustration shows where the tendon is supposed to be attached. And the image on the left shows you a live picture of that. And what we do is we open it up, we'll look for the tendon end that was torn off, and then we put it back onto the bone where it belongs. And in this case, we use something called suture anchors, which are little screws that you drill into the bone that have stitches on the end of it, and then you can tie the tendon back down to where it belongs. Sometimes, though, we can repair tendons arthroscopically, and an arthroscopy is an instrument that we call a scope, and it utilizes small incision sites. It's very minimally invasive, and it allows a camera to be placed inside and instruments to be placed inside without a big open wound. So this is an image of what a scope of a shoulder looks like. And in this case, this patient had a rotator cuff tendon. So this image right here in the letter C shows the cuff, which is a tissue that's sort of billowing up above the bone, which is down below. Normally, this tendon should be firmly attached to the bone, so this is where it's torn. And so suture anchors, similar to that hamstring repair that was open, are utilized to tack this tendon back down. So image C shows the tear with the anchors going and the stitches going through it. And after completion of the repair, image D shows that there is no longer this big gaping hole between the tendon and the bone. Lastly, the treatment that I want to talk about is arthritis. So when the cartilage wears down enough, we can certainly fix that problem by replacing that joint altogether. This is a great procedure for pain. It allows patients to be much more functional because their pain is under better control. And as you can see on this x-ray, We take out the pieces of bone that are arthritic. So it's going to be the ends of in the knee. It's the end of the thigh bone, the leg bone, as well as the kneecap. And we replace it with metal and plastic. And it's a wonderful procedure we do. People get significant pain relief from it. And, you know, in a lot of situations, it can allow patients to return to a lot of the physical activity that they want to do. So orthopedic surgery is great and it's very effective, but ultimately it would be best if I didn't have to see any athletes who are getting injured out there. So I think prevention is the most important aspect of this talk. This is a nice sort of summary of what you can do and what areas you should concentrate on in terms of training to help you stay strong, stay active, and avoid injury. This was put out by the American College of Sports Medicine. It advocates for a combination of physical activity regimens, and these 4 areas are ones that they recommend focusing on based on many studies. Endurance. So endurance activities include walking, jogging, biking, swimming, or jumping. Strengthening, including lifting weights, weight machines, resistance bands, push-ups and pull-ups. Working on your balance, especially as we age, this is very important. This can include doing crunches and side planks, lunges, and single leg stands, all to help your core, which will help your balance. And lastly, flexibility. These exercises can include yoga, stretching moves like toe touches, butterfly sits, and side stretches. So when you look at the studies, they show that the combination of these 4 areas can offset the sequelae of a sedentary lifestyle better than any one modality alone. A lot of former non-athletes can actually achieve very high levels of performance and counteract the aging process if you incorporate all 4 of these areas. The prevention and training also depends a lot on the individual. So don't expect to be able to do exactly the same exercises in each of these regimens. It's really based on your level of conditioning, what disabilities you may already have. Higher intensity is associated with greater increase in bone and muscle. However, gradual increase is much more appropriate, especially if you're elderly, deconditioned, or any individuals who have chronic injuries. Hopefully, if you continue to work on these 4 areas, you may never have to see me in the office again or ever. However, if you do need my help, I have locations at TMC, St. Mary's Hospital, as well as Rincon. This is a picture of my brand new little boy. Thank you so much for your time, and I really appreciate the opportunity to talk to you.
Thank you so much, Dr. Kim. That was great, and you've got an adorable little boy there. So
Yeah.
I had a couple of questions come in that I wanted to ask. One was about using rice. So, the rice technique. Can you use that for 6 to 12 weeks was the question.
Yeah, so most people do a combination of things. So, I always start off with all 4. Start the rest, ice, compression, elevation immediately. As your pain starts to improve, you can start to, stop maybe the icing so much, because obviously we don't want to burn your skin by putting ice on there for 6 full weeks. But it's dependent on, your swelling, your pain, and any improvements you start to see in your activity level. So if it's an ankle, for instance, when you sprain your ankle, start with all 4. And then when the swelling goes down, definitely stop the ice. And you may not need to elevate as often, but you may be elevating for 6 weeks, maybe if you've been particularly active that day. So it's pretty dependent on the patient as well as the injury. And I would just say use common sense. But if something just seems awry and the rice just isn't working, it's just better to see us and make sure nothing else more serious is going on.
Okay. And should you still exercise if you've got a strain or a sprain? And when would you know when you should work through something, work through that pain, or when you should actually see a physician like yourself?
That's a great question, and I get that all the time. I would say on average, most of my patients, I do not see them coming in having had rested much. They show up my office because their symptoms aren't improved, but they've also been really pushing through it a lot. I think rest is important initially. So 1 to 2 weeks of rest is a good way to start. I don't think a full 6 weeks is always needed. However, when you go back to your sport, for instance, let's just use running as an example, I would not recommend after 2 weeks of rest to go run your normal 3 miles. So start with walking, start with very limited jogging, maybe a quarter mile of jogging and the rest walking, and then slowly day by day progress it and see if you can get back to the level that you want to accomplish. And if you're not quite getting there, just slow down a little bit. Maybe work on a little more strengthening because you might have been a little deconditioned from not running as much as you normally do, and then slowly try it again. Once again, you get to that point where you feel like, wow, I really tried to rest it. I strengthened it. I'm really limiting how much I'm doing in terms of physical activity. It's just not getting better. That's also a good time to come see me and we can talk about it.
Okay. Now, can a strain or a strain turn into a fracture?
Not typically.
Okay.
The only fear is when you've injured something else, you're going to be a little weaker. Your mechanics are going to be a little off. So could you be more prone to a new injury, a separate injury? Possibly. But okay. It's not that it leads into a fracture.
Is there anything that you feel, I had a question asking about exercise and heart disease. Is there any sport or exercise that you feel is really works well for somebody that might have heart disease that is looking to continue to do something?
I think it's more about the patient specific sort of level of ability. So if somebody starts off very, very deconditioned, I would start off with just walking, But if I have a very high level athlete who's already an athlete and who just wants to work on their cardiovascular system, they may incorporate more weight training or a different sort of activity to diversify how they're getting their cardiac exercise. So I wouldn't say there's one specific exercise or activity that trumps everything else.
And usually it's something that you love to do, right? Because otherwise you don't do it. So I know.
Absolutely. The motivation and the and the ability to continue to do it and have fun with it is really important. That's a great point.
Right. Okay. Is there anything that you see as far as what's the most common overuse? What is there something that people are doing that it causes the most overuse in sports right now? I mean, I know knees are always hard, and
yeah, I would say just in my practice, in sort of the more mature athletes, the most common things I see are shoulder rotator cuff issues, hip, like gluteus muscle issues, gluteus tendon issues, which kind of presents as a bursitis. And then in the knee, I see mostly arthritis. Okay. So, but that's the natural process of aging. And as long as you're keeping strong and focusing on those 4 different areas of exercise, hopefully you're not going to exacerbate or irritate or injure those body parts as much if you're keeping up with those well-rounded 4 areas of exercise.
Great. Now, if somebody, I know we were talking earlier and you were sharing with me if somebody wanted more information, and I've been on your website just to see, and I've put it up here for TucsonOrtho.com / Dr. Kim. It looks like you can find out all sorts of information for specific areas that for surgery, correct?
Yes. So my website has a lot of information on the types of surgeries I do, what kind of rehab is associated with it, what kinds of postoperative. It's like basically my instructions on what to expect. Websites that have good information for sort of the layman in terms of injuries, exercises, things like that. Our academy, the American Association of Orthopedic Surgeons, AAOS.org, has a lot of patient-specific information that I usually print out to patients when I see them. And if they wanted to do home exercises instead of therapy, that's my source for where I get really good informative brochures to print out. So that's another website to try. But, I think ultimately understanding your body and keeping strong, keeping balanced, keeping flexible, and continuing that to the best of your ability is the most important thing. And that'll help prevent so many injuries and allow you to just live a healthier, longer life, hopefully.
Right. Okay. So I do also want to just share with everyone, if you are interested in making an appointment with Dr. Kim, I've got the number running on the screen right now. It is 520 784 6200. Dr. Kim is on the east side of town. You're also on the west side of town, correct? So you got a couple of different locations that you're able to see her at as well. So we've wrapped up all the questions we've received, and I just want to thank you so much for being here during our Women's Health Month. This was great, and it's a topic that we don't always get to discuss as far as sports medicine is concerned, and so it was really nice to be able to share that with everyone. Thank you all for being here today. Our next talk is going to be on Tuesday, May 25th, and we'll be doing legal planning for women. If you are interested in getting more information about that class, you can certainly give us a call in the office. The phone number is 520-324-1960. Thank you again, Dr. Kim.
Thank you.